Thank you, Rachel. 6:51 right now. The death of movie star Chadwick Boseman sent shockwaves throughout the world. Boseman was just 43 when he died of colon cancer, a disease that typically presents itself later in life. But now experts say his death highlights a disturbing trend of colorectal cancer affecting younger people in their 40s, their 30s, even their 20s. Colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. The American Cancer Society estimates there will be close to 150,000 new cases of colorectal cancer in 2020. Now, guidelines for screening begin at the age of 50, as it typically presents itself in people older than 50. But in recent years, that's changed, with doctors now seeing an estimated 50% rise in cases of people younger than 50 in the past 3 decades.
I've been in practice at Indiana University for 20 years, and when I first started, my practice was filled mostly with patients in their 60s and 70s, and my practice now is filled with patients with colorectal cancer who are in their 20s, 30s, and 40s.
As far as why more young people are getting sick, it's really unclear. There have, however, been links made to rising rates in obesity and the effect of the modern diet on our microbiome or colon bacteria. One thing is also clear here, though. African Americans are at even higher risk. Numbers say they are 20% more likely to get colorectal cancer and are also 40% more likely to die from it than other groups. Something Dr. Helf says can be attributed in part to poverty rates, lack of access to resources, disparity in screening rates, and assessment of family history. Helf says rates of colorectal deaths can be decreased by earlier screening and paying closer attention to early warning signs.
I think that the data suggests that a screening age at 45 is a reasonable idea across the broad population. What I recommend to my younger patients is that symptoms be taken seriously. So if you have serious symptoms, the most common one would be rectal bleeding.
Now, the CDC says those screenings should occur regularly, at least until about the age of 75. It's also recommended that people increase physical activity, limit alcohol consumption, and avoid tobacco.